6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20. Good morning and welcome to Heart Month.
Hello, everyone. My name is Dr. Desmar Walks, Austin-Travis County Health Authority and Medical Director for Austin Public Health. I'd like to take this time to wish you all a happy Valentine's Day. And on this day that's all about hearts, we'd like to talk to you about your heart, particularly messaging to people in our community who are busy working several jobs, struggling to have access to health care, and may not realize the importance of some of the things we're going to cover here today. February is American Heart Health Month, and we're using this time to raise awareness of heart disease, how to reduce your risk, and what to do if someone suffers a heart attack. In particular, getting help quickly. While we think of Austin and Travis County as an active and healthy community, it doesn't mean that the threat of heart disease isn't here. Every year, heart disease and cancer are leading causes of death in our community. We've also seen our rate of heart disease match that of the state of Texas as a whole. Fortunately, we have several actions we can take to reduce our risk and live healthier lifestyles. What you eat and drink can have a direct impact on your health, and in particular on your heart health. Improve your diet by including more fruits and vegetables, 5 servings a day is recommended, and increasing your whole grain intake will go a long way to help with your heart health. And by reducing consumption of foods that you eat that have high salt content, saturated fats, and added sugars will also be helpful. But one thing that we don't think of often is reducing and or eliminating alcohol consumption. An active lifestyle, too, can promote a healthier heart, and can reduce risk factors, including high blood pressure, high cholesterol, diabetes, and obesity. The American Heart Association recommends 150 minutes of exercise a week that's moderate in intensity and aerobic in character. And that means moving your body in a rhythmic and repetitive way. So you don't need to start off with running a marathon, but you can do short walks with a friend, play with your children, take the stairs instead of the elevator, and park further away from your home, grocery store, and workplace. Smoking and nicotine in particular can raise your heart rate and blood pressure and risk the development of heart attacks, strokes, and blood clots. Taking steps to quit smoking can immediately decrease your risk of heart disease and heart attack. And that's not going to just help you, but help those around you who are exposed to secondhand smoke. And lastly, poor sleep increases the risk of heart disease. Insomnia itself can increase heart disease risk by 47%. So make getting a good night's sleep, that is 7 to 9 hours a night, a priority. While we may be past the time of the year for your typical New Year's resolutions, it's never too late to start self-improvement. Ease yourself into it. Take baby steps. It's not an easy change, but it is a change that you'll be thankful for down the line. Now, to talk more about heart disease, the data, heart attacks, and response activities in our community, I present to you none other than Dr. Mark Escott.
Thank you, Dr. Walks. It's great to be here with you today. Mark Escott, I'm the Chief Medical Officer for the City of Austin and the EMS System Medical Director for the City of Austin and Travis County. Heart disease is important. I think, like most families, it has impacted my family. My father had his first heart attack when he was 40 and survived. My mother had her first heart attack at 48 and did not. So it's important to understand what it looks like, what people can look for and recognize as symptoms of a heart attack. So primarily, the number one symptom is chest pain or chest discomfort. This can be squeezing, this can be pressure, it can be a sense of heaviness. It can be in the chest. It can go to the neck, the jaw, the arm, or it can go to the upper abdomen, all of which may be signs of a heart attack. We also know that women in particular are more likely to have additional symptoms. Those symptoms include things like shortness of breath, nausea or vomiting, sweating, fatigue or feeling unusually tired, or rapid or irregular heartbeat. So all of those things may be signals that someone is having a heart attack. So what should you do if you or your family member is experiencing these symptoms? What you shouldn't do is drive yourself to the hospital. About 1 in every 300 people who experience chest pain and drive themselves or a loved one to the hospital experience a cardiac arrest on the way there. That means their heart stops completely. What you should do is call 911. All right, we have paramedics that have all the technology. They have the same kind of EKGs that can be performed in the ER, but they can do a quicker screening, they can provide treatment, they can stabilize, and they can select the right location for you to go. Not every hospital, not every healthcare facility can manage a heart attack. So it's important that you go to the right place in the right amount of time in order to get treated effectively. We also know that about half of people who have heart attacks wait more than 2 hours in order to seek care, and that's too long. So when you call 911, you will get instructions from the 911 call taker. They are fantastic in the city. If you're at a workplace or a public place that has an AED, if someone's having chest pain, you should go find it at that time as well, or send somebody else to go find it. If that person that's experiencing the chest pain or other symptoms becomes unconscious and is not breathing normally, that's when you start CPR. And I want to emphasize the not breathing normally part, because people who suffer cardiac arrest in the field outside the hospital will sometimes continue to breathe in an abnormal way for some period of time. That doesn't mean they're okay. It means that's the time to start. If you don't know CPR, we prefer that you know CPR ahead of time. But if you don't know, our dispatchers and call takers will instruct you how to do that at the time. Now, there's something else to understand about cardiac arrest. Again, that's when the heart stops. It impacts people disproportionately across the state of Texas and across this community. In 2021, myself and colleagues from around the state of Texas published a study looking at the disparities associated with cardiac arrest in the state of Texas. And what we found is Hispanic neighborhoods, African American neighborhoods, and neighborhoods with low socioeconomic status had higher rates of cardiac arrest, lower rates of bystander CPR, lower rates of automated external defibrillator use, and of course, because of that, lower survival. For our local numbers, we know that African Americans in Travis County represent about 9% of the population, but account for 23% of the heart attacks treated by Austin-Travis County EMS, and they account for 17 to 18% of those who suffer an out-of-hospital cardiac arrest in this community. In Austin and Travis County overall, our survival is better than the national average. About 12% of those who suffer a cardiac arrest will survive that event. But when a bystander starts CPR, that number is tripled to about 36%. So CPR and AEDs are incredibly important, and we simply can't wait for first responders to arrive. It's important for every member of this community to take the time, and it is very brief, to learn CPR at least once in their lifetime. We have several, I should say that our bystander rates overall for CPR and AED use in Austin-Travis County trail behind the national average, which is why we are very concerned and want to increase those numbers. If you don't know CPR, we have a solution for you. Austin-Travis County EMS offers several free CPR and first aid classes around the community. You can Google us or pull up the website and follow the instructions for the injury prevention and outreach section. You can call our number at 512-497-3264. We have a free class coming up February 25th from 5 to 7 p.m. at the Virginia L. Brown Recreation Center. Again, you don't need to schedule it, you don't need to reserve it, you just need to show up at the center from 5 to 7 p.m. on the 25th. And one last request is for business owners, for churches, schools, community centers. please call. Please help us train your folks in CPR, and please invest in an AED at those sites. The more defibrillators we have around this community, the more likely we have the opportunity to save people's lives. Thank you very much. Taking questions?
We're going to take questions real quick before we move on to the presentation by EMS. Does anyone have a question?
Come on up. All right. Thanks so much.
Thank you.
Okay. How are we going to be positioned?
I'll take this one.
Okay. Take that one. When you see 2 green lights, that means it's 2 inches and 100 to 120.
Okay.
Right here?
No, like, you guys just come this way, so you're in like a little triangle almost.
Oh.
Like yours right there.
Any specific
There you go.
All right, let me know when y'all ready. All right, so first thing we want to do is make sure the scene is safe, come in and assess, make sure that the scene is safe. Then we're going to come, try to, check for response. We're going to kneel down, tap on the shoulder. Hey, Kevin, can you hear me? If you know their name, call out to their name. Ask them if they're responsive or not. We're going to check for signs of breathing. Just as Dr. Escott mentioned, we're going to check for normal signs of breathing. We're going to give ourselves 10 seconds to do that. So we can look, listen, and feel. We can put our hands on the chest to see if it's breathing or see if it's moving or not. If they're not breathing, then at this point, we want to point to somebody, sir, go get an AED, call 911, come back. If not, we can take out our phone, put it on speaker, dial 911, and go from there. At this point, we're going to go ahead, place our hands just right on the chest, right on the middle of the chest, make sure our arms are straight, lock our elbows, and then we're just going to start compressing. And we're just going to keep going. And this is hands-only CPR. We will keep going. At this point, if we're on the phone with dispatch, dispatch will talk us through it. They will possibly help count with us to keep us on track. And then we would just keep going. Once an AED comes in place, then we will go ahead and stop. If somebody can set it up for us, that would be great. We can still do compressions. And as we are doing compressions, they can add the AED pads just around their hands. So we're going to go ahead and stop with that. We have the AED in place. We're going to go ahead and turn it on.
Do not touch the patient. Analyzing heart rhythm.
Everyone stand clear.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Charging. Stay clear of patient. Deliver shock now.
The AED is charged. One last time. You're clear, I'm clear, we're all clear. We're going to go ahead, press the shock button. After we press the shock button, hands right back in the middle of the chest, and then we continue with our compressions. And then we just keep going. So when we do our compressions, we're going about 2 inches deep on the chest. We're going at the rate of 100 to 120. Yep.
People don't need to blow in the mouth?
No, not necessarily for the hands-only CPR. We're just doing compressions. We're getting that oxygen-rich blood going through the body. We're doing what the body can't do and giving them a fighting chance as we do compressions. Yep. And then that's it.
First song that you play in your head?
There are several songs we could play in our head that are at the rate of 100 beats a minute. Very popular one is Staying Alive by the Bee Gees. Find a song, play it in your head. Yep.
Thank you. Do you have any questions from media? All of our photographers know CPR now?
Want to come try it?